Hello, everyone. My name is Yuanxi Jia. I'm Associate Professor at the Chinese Academy of Sciences. Now I'm presenting our study titled Trends of Randomized Trials, Citing Prior Systematic Reviews in the Past 15 Years, a meta-research study. Why do RCTs need to cite systematic reviews? That's because systematic reviews can help RCTs in many ways. First, systematic reviews can help justify an RCT. For a given clinical question, a high-quality and up-to-date systematic review can suggest whether prior evidence is adequate. This ensures that the new RCT is necessary and not redundant. Second, systematic reviews can help inform the design of an RCT. For example, they can provide the parameters for estimating the sample size. They can also assess the quality of prior similar studies to suggest the best methods. Third, systematic reviews can help put the results of an RCT in context. They can be used to compare the results of the new RCT with prior similar RCTs and assess the impact of the new RCT on the overall evidence. Some prior studies suggest that the citation of systematic reviews in reports of RCTs is low, but they have some limitations. For example, they have a small sample size and are restricted to a certain clinical condition or intervention. In the past decades, many stakeholders have been working hard to improve the citation of systematic reviews in reports of RCTs. It is very important for us to know if those efforts have paid off. Unfortunately, no prior studies were designed to answer this question. So our study had three aims. First, to assess the trends of RCTs citing prior systematic reviews in a sample without restrictions on clinical condition or interventions. Second, to compare the citation of prior systematic reviews across clinical specialties. Third, to assess the factors associated with the citation of prior systematic reviews. This study uses Cochrane reviews published from inception to August 2021. We selected Cochrane reviews with at least one update. For example, to answer a question, 5 RCTs were published first, followed by the first version of a Cochrane review summarizing all those 5 RCTs. Thereafter, 5 new RCTs were published, followed by an update of the Cochrane review. We can see from this figure that there was no prior systematic reviews to cite for the first 5 RCTs, but these 5 new RCTs could cite the first version of this Cochrane review. We also considered the publication delay and added a 2-year grace period to make sure that the first version of the Cochrane review was eligible to cite when the manuscript of the new RCTs were under development. Thereafter, we included 4 RCTs and considered them eligible to cite the first version of the Cochrane review. The eligible RCTs were assessed for the citation of prior systematic reviews. If a Cochrane review has multiple versions, any version could be cited by eligible RCTs. Eligible RCTs could also cite non-Cochrane reviews. Non-Cochrane reviews were considered eligible if they met our predefined methodological prerequisites that they searched at least 2 bibliographic databases, reported any form of quality or risk bias assessment, and intended to include RCTs. Non-Cochrane reviews were expected to be clinically relevant, that they assessed similar health conditions and interventions to eligible RCTs. The choice of eligible RCTs, citing Cochrane reviews, non-Cochrane reviews, and systematic reviews of either type, were assessed by linear regression models. The citation of prior systematic reviews was compared across clinical specialties by a CMH test. The potential factors associated with the citation of prior systematic reviews were sample size more than 100 or less than 100, single or multiple recruiting centers, different sources of funding, such as industry, non-industry, no funding, or not reported, authors from developed or developing countries, and the requirements of journals, such as explicit requirement referring to the consult statement, or no requirement of the citation of prior systematic reviews. Here are the results. We have screened almost 9,000 Cochrane reviews and included 4,003 eligible RCTs from 737 Cochrane reviews. Among the 4,003 eligible RCTs, about 31% cited Cochrane reviews, 42% cited non-Cochrane reviews, and 57% cited systematic reviews of either type. Most eligible RCTs recruited more than 100 participants. Recruited participants from a single center, were conducted by authors from developed countries, refer to the consult statement, and were funded by non-industry. This figure shows the trends of eligible RCTs citing systematic reviews. The percentage of eligible RCTs citing Cochrane reviews has increased from about 15% before 2008 to 41% after 2020. The percentage of eligible RCTs citing non-Cochrane reviews has increased from 25% before 2008 to 64% after 2020. And the percentage of eligible RCTs citing systematic reviews of either type has increased from 35% before 2008 to 72% after 2020. This table shows that the citation of prior systematic reviews varies a lot across clinical specialties. The percentage of eligible RCTs citing Cochrane reviews was about 42% in psychiatry, while only 9% in dermatology. The percentage of eligible RCTs citing non-Cochrane reviews was 56% in orthopedics, while only 15% in ophthalmology. The percentage of eligible RCTs citing systematic reviews of either type was about 70% in psychiatry, while only 26% in ophthalmology. This table shows that 3 factors were significantly associated with the citation of prior systematic reviews. Eligible RCTs with more than 100 participants are 1.15 times more likely to cite prior systematic reviews than those with less than 100 participants. Eligible RCTs with non-industry founders are 1.43 times more likely to cite prior systematic reviews than those with industry founders. Eligible RCTs with authors from developed countries are 1.1 times more likely to cite prior systematic reviews than those with authors from developing countries. This study has 3 limitations. First, we are not sure how much the cohort of RCTs from Cochrane reviews can represent all the RCTs. Second, we used the Web of Science to screen the references of eligible RCTs for non-Cochrane reviews. So we may have missed some non-Cochrane reviews that are not indexed in the Web of Science. Third, we used keywords to search for non-Cochrane reviews. So we may have missed some non-Cochrane reviews without keywords in their title or abstract. We have 4 conclusions from this study. First, the citation of prior systematic reviews in reports of RCTs has improved over time. Second, the citation of Cochrane reviews was significantly lower than non-Cochrane reviews, especially in recent years. Third, RCTs with larger sample size, non-industry funding, and authors from developed countries were more likely to cite prior systematic reviews. Fourth, about 40% of reports of RCTs fail to cite prior systematic reviews. In some clinical specialties, this number falls to only a quarter. Evidence-based research should be further promoted. I'd like to thank our colleagues for their hard work. This study is an international collaboration among researchers from China, United States, and Norway. If you have questions, please email me and I'll be happy to address them. Thank you.